Hello there, this is Dr. Ritamarie Loscalzo, and I am here today to talk to you about a subject, a health topic that's very near and dear to my heart, and have a lot of interest in this topic and a lot of passion around this topic, and the subject is thyroid. I've done some basic videos on thyroid before, and I really wanted to get into the heart of thyroid and how you can assess what's happening in your own thyroid, whether you have a thyroid problem, an overt thyroid problem, or a subclinical thyroid problem, or a thyroid problem that's waiting to happen. And what do I mean by that? It's like, what do you mean, a problem waiting to happen? There's an epidemic of thyroid problems in our society, I believe, that just about everybody knows about it. And when I have people coming into my office, a really high percentage of them have been on thyroid medication or have been diagnosed. But there's a condition that's often overlooked, and it's actually the cause of about 80% of hypothyroid. And it's autoimmune thyroiditis. It's sometimes called Hashimoto. So that's the official, medical name for it, Hashimoto's. And it's a condition that most docs don't even test for. So let's look at how we test for your thyroid. What are the markers in your blood? What are the extra special tests that most docs don't do so that you can determine this? And if you do have either a subclinical thyroid problem showing up or an autoimmune problem, how do you nip it in the bud before the antibodies eat away at your thyroid? Let me ask you this. Would you rather deal with a problem when you know, like say there's a ferocious animal about to approach and eat your family and your house? Would you like to know it when that tiger is a mile or two away? Or do you want to know it after you come home and the tiger's eaten away at your entire house or eaten your kids or your family? Which do you want to know? I want to know when it's down here. I want to know when it's drooling and ready and looking at me and ready to attack so that I can get that attack to stop so that my house is not destroyed. And this is what's happening in our testing. When you go in to get a routine blood analysis, one of the things they will check for is thyroid. And they'll tell you, oh yeah, we're checking for your thyroid. But all they test is one thing. They test TSH, thyroid stimulating hormone. And that's a hormone that's produced by your pituitary gland that tells your thyroid, hey, wake up thyroid, make some thyroid hormone. And if that level gets really high, what it means is that you've got an unresponsive thyroid, that your thyroid's not able to just take the gentle tap on the shoulder. Thyroid, make some thyroid hormone from the pituitary. And the TSH goes up, the pituitary has to shout. And it talks louder and louder, and the TSH level goes up and up. And the TSH levels will go up before the thyroid hormone goes down. It's interesting because years ago, most doctors didn't even check for TSH. I would get these labs back and they tested for T4 and their T4 was fine, so they told the person they were fine. I'd say, well, didn't they test the TSH? TSH is an earlier marker for this. And they'd say, no, they never tested that. Well, now that's the standard routine of care. So medicine is caught up. But the thing about TSH is there's a normal range. There's a normal voice at which your pituitary should be speaking to your thyroid. And that level has been, in labs, if you look at your lab report, it says it's between 0.5 and 5.5. That's a very broad range, and it doesn't catch a lot of subclinical thyroid and even some overt thyroid problems. The American Academy of Endocrinologists several years ago came up with a revised range for the thyroid, and they said it should be somewhere between 1 and 3. Well, the labs haven't caught up. They're still telling people that if you're 5.2, you're normal. And so doctors are acting on that advice, and they're not checking any further. Well, what happens with this situation is it just continues to deteriorate until they get to the point where the TSH is above the 5.5, and then the doctor says, oh, you need Synthroid. We need to give you more T4, which is the thyroid hormone. Well, oftentimes they're giving you that T4 when your thyroid is already producing enough T4. So they're not really addressing the problem. So let's look a little bit at the thyroid chemistry. You have this gland called your thyroid, and it produces a hormone called thyroxine, also known as T4. It also produces a very little bit of a hormone called T3. Most of the T3 is actually converted in your tissues from T4. So once you produce this T4, it's kind of a storage form of the circulating hormone. It circulates around in the blood, but it's not active. T4 is not active. It's a storage form. And so as needed, the T4 gets converted to T3. But then there's still another step. The T3 is now floating around and it's protein bound. It's bound and it's not active. In order to activate it, you have to take the protein molecules off and turn it into free T3. So 80% of your thyroid activity is free T3. Who's measuring free T3? Practically nobody. Okay, so that's your marker. When I look at it, I like to look at what's the ratio between total T4 and free T3. What's your thyroid making? What's your tissue actually getting? The others in between are nice to know, but that's the critical pieces, in my opinion, of what you need to be looking for. And if your total T4 is really good, but your free T3 is really low, your problem is not in your thyroid. Your thyroid's making plenty of it. Your problem is in that conversion. And that conversion can get whacked out if your liver's not functioning properly, if your digestion's not functioning properly, or if you're producing a lot of a hormone called cortisol, which gets produced by the adrenal glands. So there's a lot of things that go into making up whether your thyroid, quote unquote, is functioning. And your so-called thyroid problem may not even be a thyroid problem. Your thyroid's given all this blame for doing all this bad stuff when it could be a problem with the pituitary, it could be a problem with the liver, it could be a problem in your digestion, and it could be just that you're so stressed out that your body's not able to do these conversions. The other thing that people don't realize is that all of that stuff can be normal and you can still show thyroid symptoms. Why? Because every cell in your body has receptors for thyroid hormone. And those receptors have to be open and ready to receive the thyroid hormone. Well, there are things that cause those to get shut down. So if you've got a chronic inflammatory condition in your body, those receptors get resistant, they close down. And even though you're producing enough of your thyroid hormone, nothing's happening. It's not getting into the cells. So we get thyroid resistant. And stress is another thing. High levels of cortisol, which is the stress hormone, can disrupt those receptors. So you see it's a much more complex problem than go to the doctor, have your TSH checked. If your TSH is in normal range, quote unquote normal range, then you're fine, you don't have a thyroid problem. There's so much more to it. And then you have all these thyroid symptoms. You're depressed and you're not able to lose weight and your skin is dry and your skin is rough and your reflexes are off and you have no motivation. All these things happen and you're saying, well, then why are all these symptoms happening? This sounds like a thyroid problem, but I'm not showing any thyroid problem. What's the problem? And very frequently, persons prescribed Prozac, or an anti-inflammatory medication, or something that doesn't really address the heart of the problem. And this is a real problem. Now I'm going to take this to the next level. A very common cause of low thyroid function is a condition called Hasimoto's, which is antibody. Your body's producing antibodies. Well, nobody ever checks for this. Almost nobody ever checks for this. And what I believe, I use antibody screening as part of my general screening. If a person has any kind of symptoms that would suggest a thyroid problem, I'm testing for the antibodies. Why? Well, I have found that the antibodies could be present years before the thyroid starts to malfunction. Years. So it's kind of like that hungry tiger. We want to know years before that those Hashimoto's antibodies, those thyroid antibodies start destroying the thyroid. Wouldn't you want to know beforehand? So I've had lots of situations where I've tested that on people. And sure enough, their TSH was even in the ideal range. It might have been 2. And their T4 was great and their free T3 was great and all the thyroid numbers looked good. But they had antibodies. What that means is there's a little disease lurking, waiting to happen, that it's destroying the thyroid, and we want to do things to balance your immune system before that happens. There's several ways that you can do that. One is by getting off of gluten. There's a high correlation between gluten antibodies and thyroid antibodies. And there have been studies that show that after 6 months of being off of gluten, the thyroid antibodies go away. There have been studies that have shown that the thyroid antibodies are settled, and then you get an accidental exposure to gluten, and it goes up. I mean, obviously in a study it was done deliberately, but it's like equivalent to an accidental exposure. A small amount of gluten causes a flare-up in those symptoms. So getting off of gluten and also identifying if there are any other foods that you're allergic to, possibly dairy, possibly soybeans, possibly peanuts, it could be eggs, it could be anything. So antibodies will cause inflammation in the thyroid, but the one that's most associated is gluten. Okay. So what else can you do? Well, selenium is a super important nutrient for the thyroid gland, and it's important for keeping your thyroid levels good. It's also important for that conversion that we talked about, but it's also important in terms of the antibodies. And there have been a few studies which showed that levels of selenium, about 400 micrograms of selenium a day, which is the equivalent of about 2 to 4 Brazil nuts, is enough over the course of 6 weeks to bring the antibody levels down. So if your antibodies are there and your immune system is messed up because of the lack of selenium, that's going to solve your problem, or at least be part of the solution. So getting off of gluten, adding some selenium, great ideas. The other thing is really supporting your immune system. Making sure that you've got really good nutrition for your immune system. One of the really important critical nutrients in this area is something called glutathione. It's a really potent antioxidant. And unfortunately, about 48% of the population that they've tested has a genetic variation that doesn't allow them to make enough glutathione. And so it's really important to determine, supplemental forms of glutathione, nutrients in foods that stimulate the production of the glutathione, foods, things called methylation factors that help your body in that whole pathway of conversions to glutathione. So there's several supplements, and I work with people on those supplements that actually help with that. N-acetylcysteine is one of them. It's a particular complex of 3 amino acids that your body can convert to glutathione. So antioxidants are super important when you have a thyroid antibody problem, and supporting your system, making sure that you're eating lots of antioxidant-rich foods, lots of green leafy vegetables. The other thing that's super, super, super important is vitamin D. Without vitamin D, your thyroid does not function properly. Your digestion doesn't function properly. Your whole antioxidant system in the liver doesn't function properly. So I highly recommend that you get vitamin D. So my basic screening when somebody comes into the office is I will have them do a general, blood test with CBC. I have them do their vitamin D3 levels, and I have them do their thyroid antibodies. And then based on what we find, then we come up with a program or we do further testing. So it's really important. And I've seen the thyroid antibodies reverse. It does take some time, it does take some doing, and it takes some diligence about your diet and your supplement program. So that's the thyroid in a nutshell. If you have your own labs and you want to pull them out, you can take a look and see if any of these things have been done. If you have thyroid symptoms, and I'll review those again, dry skin, dry hair, thick, coarse hair falling out, cold hands and feet, high cholesterol is one of the signs of a thyroid problem, anemia, slow reflexes, inability to lose weight in spite of a low-calorie diet, weight gain, depression, fatigue. These are all problems that can be associated with the thyroid. Now, if you have one of those problems, that doesn't mean you have a thyroid problem. But if you have several of those symptoms, it's worth it to investigate. And the testing that I would recommend you do is your TSH, your T4, the free T3, so total T4, free T3, and your thyroid antibodies, thyroid peroxidase antibody, and what's the other one? Thyroid peroxidase and antithyroglobulin antibody. And you'll have a good picture of what's going on with your thyroid, and then you can start to approach it from the standpoint of cleaning up your digestion, supporting your liver, decreasing your stress, making sure you have plenty of selenium, and looking at supporting your antioxidant systems, and iodine is probably something to look at as well, depending on what's going on in there. So I appreciate your attention. This is a really important problem, and I think it's undiagnosed in a lot of people. I have had people come on to my group coaching calls and talk about their labs and discover after like 15 years of chronic health problems, chronic anemia, all kinds of energy problems, not feeling well, and discovered that the reason was they have a thyroid antibody problem, that they have an autoimmune thyroid condition that nobody's picked up. And now she has an answer. Now she has a solution. And yeah, it's going to be some work, but now she's on her way to restoring her health and feeling whole again. So I want that for you. This is Dr. Ritamarie Loscalzo, and have a really great, wonderful, energetic day.